with measles in Ukraine, and I would like to present our speakers. This is Oksana Syvak, Deputy Minister of Healthcare of Ukraine and European Integration. Marthe, Everard, head of the World Health Organization in Ukraine, and Giovanna, Barberis, UNICEF representative in Ukraine. And I would like to give the floor to Oksana Syvak in order that she tells us about the situation with the measles in Ukraine now and what we should do in order to prevent disease and to help others. So I would like to start that measles is the infectious disease that is really dangerous, and the only prevention is vaccination. So I will speak about figures, and we should focus our attention on the fact that vaccination is really important. As of today, we registered 735 cases. Each 5 or 7 years, we have such outbreaks. So this is natural. The reason is this is a contagious, highly contagious disease, and low level of vaccination. Last time we had it in 2001, 2006, 2011, and in 2012 there were 13,000 cases of measles, and unfortunately we had 3 lethal cases. So it is to inform people that this disease really exists, and this happens every 5 or 6 years. And in 2015, there were 105 cases, and in 2016, 102. And I would like to tell you about figures, and I would like to draw your attention who fell ill, who caught this virus. So in 6 months this year, we registered this virus in 15 regions. In Ivano-Frankivsk Oblast, 392, and including children, and this is really of concern. And there are 2 pregnant women who fell ill, and one of them have confirmed cases. And the figures I would like to represent, according to the analysis of those who caught this virus, 76%, 20% of those who fell ill got 1 dose of vaccinations. And you know that you have to have 2 vaccinations at 12 months and in 6 years. So those people who got this vaccination, they have a protection of 98%. So this is the guarantee that out of 100, only 1 person may fall ill, and this is the efficiency of vaccination. 86 people from Ivano-Frankivsk were not vaccinated, and 182 we lack this data on their vaccination. This is surprising. So if there is no such data, I would say that these people were not vaccinated. So this number of people who fell ill, so this is because they were not vaccinated. And I, as a Deputy Minister of Healthcare, we are responsible for public health, and I would like to focus your attention, especially the media. Please, we should present positive image of vaccination. Vaccination really works, and we see it in figures how it works. And in the world, in the civilized world, in Europe, we say about elimination of measles. So in some countries, people do not fall ill from this disease. But this is just because they are vaccinated. 95% of vaccinated people should be in the country in order to support this. And last year, overall number of those who were vaccinated only 46%, and this year we work actively with parents, with medical workers, and for me it is really of concern. I mean about medical workers, because among our workers there are some people who have negative attitude towards vaccination. And I, as a doctor, I believe that this is a crime, because every doctor, every nurse, they should 100% promote vaccination. And I address parents and people who get vaccines. If a doctor or a nurse, if they say something negative about vaccination, please report on these cases, because this is a crime. It cannot be. This is a protection for your child. And if a child fell ill, I won't speak now about measles. I would like to say that last year we also had problems with the difficult cases of tetanus, and there was a hysterics of parents, and I wanted to say, Mother, where have you been? So if medical personnel won't tell this, please promote vaccination. And also about the outbreaks. Odessa Oblast, 275 cases, 67 cases, and also including children. And we analyzed the status of vaccination. 92.3% are without vaccination. 5.9, only one dose of vaccine was injected. So if we said that first there were no vaccines there, but now we have 100% of vaccines, and in December we got more than 1 million doses that were bought through international organizations and through UNICEF, and we have signed contracts on supply of 583, and we need 1 million, more than 1 million per year. So this is the children, they get first dose of vaccination, then second vaccination is at 6 years, and for the children that were not vaccinated previously, because there were no vaccines in some years. So now we have 100% of vaccines. So there is no any reason not to be vaccinated. So turning back to statistics, in 3 months in 2017, vaccinated are 22% and revaccinated 21.8%. So each month, 7 or 8% are vaccinated. So if we support this regime, so until December we will get 90%. So we should increase, and we see the trend 7 or 8%, and this is good. And we should continue with this, and parents should vaccinate their children regularly. So this is about figures. And now I would like to give the floor to my colleagues, and I am ready for the questions. I have a question about adults, what they should do. Should they be vaccinated? What do you recommend? You should be vaccinated. This vaccine that we have, this is for children. And now we have some funds. That's why we want to work to buy this vaccine. This will be another vaccine, and this will be in the nearest future. And local budgets, they have the right and funds to buy this for adults, especially for medical workers. And in Odessa, there are cases when medical workers fell ill. So this was a hospital infection, and among adults, those who should be vaccinated, these are medical workers. It is surprising that they are not timely vaccinated, but we do not want to speak about the past. We need result as for now and good prospects and elimination of this problem in the future. So now I would like to give the floor to Marthe Everard, about the position of the World Health Organization in Ukraine and the opinion how to solve this problem.
Thank you very much, and I'm very happy to be with you here and to support Dr. Syvak. All her statements are correct, and it is very important that we bring this again to the general public, that and we now in the holidays, so I would like also to support the fact that all children should be vaccinated when they go back to school. This is also done at the moment in Italy, as you know. That is not only an Ukraine issue, that the outbreaks of measles. We have a huge outbreak in Romania. We have a huge outbreak in Italy. And it is all indeed related to that parents do not see the reason why children should be vaccinated. Because they don't see the disease. If the disease comes, you are too late. Let me make it very clear. And you risk a lot. Because measles is not without any complications. Children die. And you don't want to have that on your list, that you have contributed to that. Parents should vaccinate the children. We here sitting all together, we are all vaccinated. And because we were all vaccinated, the virus could not spread. It is the interruption of the virus that we have to get. It is that the virus cannot jump from one to the other. Now, your children are going now to all kinds of summer schools. There you are. It is when they are sitting in groups together, and if one has the virus, you get infected. If you have been vaccinated, you don't get anything. And that is why we sit together here and we are having a healthy outlook. Parents, you should take this responsibility that also your children should get the treatments and the tools that is available to prevent. We are starting now more in the prevention mode. We have to prevent for what can happen. Yeah, it is a very strange idea, but this is what it is. Prevention is better than the cure. And I want to say that very loud and in support of Dr. Syvak's statement. So, it is important that all children before the age of 6 are getting 2 doses. Very important, because that is key. Therefore, again, try to convince yourself, your neighbors, that all the children that go to the same school, the same kindergarten, and the same summer school get vaccinated. It is important also to know that Ukraine is worse in whole of the European region. And the European region is here also with Central Asia, this the other countries, not only the European Union. It is also the whole European region, 53 countries. Ukraine is the worst. This is a bad result. This is not good. Less than 30% of measles, that is asking for measles outbreak, what you have seen. Now at the moment we are very worried, Odessa and 13, 14 other, yeah, Ivana Franka also, but that spreads. Because people are moving, people are traveling, people are meeting each other. That is important, and you as an adult can bring it over to your children. So please be aware that this infection should stop. And we are all contributing to that when we are not vaccinated. And indeed, 2 doses is sufficient for the rest of your life. So 2 doses of vaccines before the age of 6, that makes a child happy. And also, as you know, there are combinations. You can have measles, mumps, and rubella. Also, rubella is the highest in Ukraine for the rest of Europe. We have to do better. The country has to do better. Yeah? So we call it the MMR vaccine, 3 in 1. Benefit from this because they are also available, and WHO is standing in for the quality of the product together with UNICEF. We have this obligation for the whole world, not only for Ukraine. I leave it by here and I give the floor to my colleague UNICEF.
Thank you so much.
Is this working?
Yeah, it works.
Thank you so much, and good morning to all of you. Deputy Minister Marthe, I can only reiterate, you know, the messages that have been very loudly and clearly already put forward. We are facing an outbreak a measles outbreak in some areas of the country. It is very unfortunate. Measles, as it was already said, it's a preventable, disease. And it is a dangerous disease. I mean, children can die, and are, there are cases where children are dying because of measles. There are vaccines available in the country, so this is not an excuse. There is availability. UNICEF, on behalf of the Ministry of Health, has procured and brought into the country in 2016 around 1.3 million doses of MMR. There are 600,000 or 583,000 doses for 2017 that are in the pipeline. At the moment, we know that there are 900,000 doses of MMR available in the country. So again, the availability is there. Parents and doctors shouldn't hesitate to advocate for and to bring children, to be vaccinated. It is the messages that have been already shared are extremely clear, and we cannot, do anything else than joining, the Minister of Health and WHO in saying, really bring your kids to the health facility. There are children that have missed, one round of vaccination. The doctors should encourage, parents to bring their kids to the health facilities. This is the season where, children are getting together for different reasons because of the summer camps, the recreational activities. So it is very easy that the disease is spread. It is highly contagious. So this is what is happening. We cannot react only when we have an outbreak, because this is also what has happened with the polio, in 2015, 2016. There was now, with the outbreak of polio, there was the great realization that the coverage was extremely low, that parents' knowledge was extremely low, the doctors were, quite resistant to advocate for vaccination. Things had improved, the coverage had improved thanks to the campaign we have supported all together. But now, again, we are back into the same sort of mode with another outbreak. And we cannot continue working this way. I mean, the immunization program should be reaching, a certain level of, satisfaction and effectiveness to really enable, a healthy life especially for children and among children. So I cannot, I can only, join my colleagues. We are here to support any effort of the Ministry of Health in terms of monitoring, communication, procurement. But it is very important that we really work together and we try as much as possible to avoid further spread. It is extremely alarming, the situation we already have. Thank you.
Thank you so much. Дуже дякую. Шановні журналісти, ще є у вас запитання? Зараз про кір говоримо, будь ласка.
Are there any questions? Please introduce yourself, journalists. I have not a question not about measles. And who has questions about measles? Людмила Голодник, Fifth Channel, TV. Now you tell that adult vaccines are not available. How often adults should be vaccinated, and what are the prospects when adult vaccine will be available? Adults should be vaccinated only those who have not been vaccinated in childhood. We have the group of people who have missed the rounds of vaccination. Sometimes, unfortunately, it was to their regret just rejection of their parents from vaccination. But now these adults should go and be vaccinated in order to live a healthy life. I hope this year. I can't tell you specific deadlines till which we will get adult vaccines. This is not the justification. We have the right to buy vaccines according to the law only for children, according to the schedule of vaccination. This is what Ministry of Healthcare can spend money for. So we need changes, we need amendments to the legislation to be introduced. This is what we are working on. But the regions, the authorities have the right to buy the vaccines doses for adults. They have no limits. Only Ministry as budget funded organization have such limits imposed. What about adults? Can they buy vaccines and go to some private clinic and get vaccinated? If a private clinic has bought vaccines, of course you can go there and get vaccinated. Yes, I'm telling you that just local authorities also have the right to buy from budget funds these vaccines. I have a specifying question. How many people have been vaccinated in Ukraine? What is the percentage, and what will be the cost of vaccine dose for adults? And if the government will buy, will it be free of charge? I will not tell you what will be the price. I don't know. But if the vaccine dose would have been bought, it would be free of charge. I'm not working with private clinics, I can't tell you, but we are talking about local budgets, budgets which are from the proceeds of our taxpayers. They are formed. That is why it would be free of charge. Percentage of coverage last year, it is hard to say about the whole population. We are talking about the vaccination rate, annual vaccination rate of children. This is the figures which we give. It was 46% last year. It is very low, but this year we hope to have 90% by December. So you as parents should be warned and aware that in that group in which your children go, there is collective immunity available. Vaccination prevents disease by 99%. This 1% is still available. So our collective responsibility, our joint responsibility, I'm talking as a mother, not as a deputy minister. If in a group of 30 persons, only 5 children have been vaccinated, this is violation of the rights of my children, because their chance not to catch a virus is very low. We have problem with the legislation. We have collision. The Ministry of Healthcare is telling that children who have not been vaccinated, they do not have the right to go to school. But the Ministry of Education has the other law saying that access to education is free and no vaccination cannot prevent a child from entering the first grade at school. But from my own experience, I know English, and my colleagues and friends came to me, and when my friends' children were 16 or 18 years old, they went abroad to study in Germany or other countries, and the children have not been vaccinated, so they were vaccinated within 1 week because they were not allowed allowed to study in Germany or other European country. So in the USA, in Europe, those schools, they do not allow children to go to the collective, to the groups without being vaccinated. So vaccination protect people. And what people, Marthe told already that we are the worst in the European and Asian region. 50% of non-vaccinated children live in Ukraine. We are a threat for our neighbors. And our neighbors and everyone is very concerned about this. I would like to say that buying certificates about vaccination, this method is already known in Europe, and we have already 2 cases when children have passed exams and tests and tenders. Yes, they brought certificates of vaccination, but our certificates are not believed in other countries, and when the blood samples have been taken, it was the situation that they were not vaccinated in reality, and those 2 very talented children, they were stopped from studies abroad. Now, more questions.
I have a question. I would like to ask 2 questions. As of today, what cases of this is about other issue. This is not about measles. This is about the percentage of those who fell ill of botulism and the deaths, lethal cases from botulism. This situation is worse. Botulism is, there are cases of botulism in our country. We have 62 cases, and among them 9 cases are lethal, and this is really bad result. And about percentage, about people, 9 deaths. In Kiev, I will tell that people are poisoned from some food in Kiev. Fish was the cause. In Odessa also fish, sun-dried fish. Poltava, sun-dried fish also was the reason. Sumska region, sun-dried fish also was the cause. And Cherkasska Oblast, sun-dried fish, both of domestic and industrial production. And also, so there is a threat to get this disease from this type of food. So the quality of this food maybe was really low even before it was processed. So we have problems with the serum, and we can use only registered. So we have no registered serum. We in 2014 Russian serum expired, and then producers, they do not want to be registered even under simplified procedures. And we have negotiations and agreements with international organizations, and there will be humanitarian assistance. These serums will be provided, and I won't tell you about the percentage of the serum. So they should be bought through local budgets, and I don't have this information about the regions and what local government do in this respect. I don't hear the question. They don't have mic. what to do when people get this diagnosis, if they have botulism, and what is the treatment in the hospital efficient, and what about the serum? Does it really prevent lethal cases? So the most efficient is serum, and it will be introduced timely. And if there is this virus and it has connection to the nervous system, then it will really harm the system. So we understand the problem, we work on this, and people should address the doctor as soon as possible. And this disease can be revealed, and if you have symptoms of the disease, you should not stay at home and think this is just some poisoning. And if a person, especially at this sun-dried fish, so the responsibility for food products, this is the responsibility of the agrarian product service, and they are responsible for the products suppliers bring to supermarkets. And it is really disturbing that some cases are connected with industrially produced food. So this is really of concern. It looks that the system of verification doesn't work properly. Also, we have the moratorium on verification until the end of the year. So the Ministry of Health Care does not have the right for any verifications and checks. This is the responsibility of the special service. But they can have these verifications made. But if there is registered case of such poisoning by some product that was sold in supermarket, all these products should be revoked and destroyed. But you understand that we have cases, right? We have cases around Ukraine. Do you have other questions? Please ask. Tell us, please, about the international organizations, about the doses and when they will be in Ukraine. We have agreement with the Red Cross, International Red Cross, and the UNDP about doses. The more, so we have 62 cases. That's why we need several hundred of doses, and we should understand that this is a serum, this is not tablets, and it expires soon. That's why there should be also special conditions for the serum. That's why the drugstores do not want to buy it, and it should be done at state and local government levels, and we should do more prevention. And this is not like measles. Of course, we should vaccinate children against it, but here in this case, this should be done really timely in case of this issues arise. So I cannot tell about time when it will arrive. So on the internet yesterday, I saw many proposals of uncertified serum. Is it efficient, and can we buy it if doctors say you may buy it? According to legislation, it should be registered in Ukraine. But if these are European producers and they are qualified by the WHO, it means that it is safe. Thank you.
I would like to react on internet buying. That comes with an enormous risk, because it can be products that has not been registered in any European country, and it can also be a batch that is not meeting the quality that it needs. So be very careful by buying by internet. That is very difficult, and you take your risk if, especially for this kind of products, they are very expensive and maybe not working very well. Botulism is indeed a very rare outbreak. It comes and it happens in small areas, but this is a case that was indeed what you said, Dr. Syvak. It was an industrial manufacturer who was producing this sun-dried fish. Now that means that this company should revisit its own procedures. There is definitely something that went completely wrong. The product is not fresh, and therefore we should be very careful. It is a very severe food poisoning, and I have followed that because also the WHO is following this outbreak, because all the outbreaks that happens in countries has to be reported, and this has been reported also, and we follow and give advice. So this product of this particular company has to be taken immediately off the market. We heard that it was done. So in principle, that product should not be available anymore. So the population should know what is the brand, what product, and therefore it should be recalled. So big advertisement should come into the newspaper by the company to recall his product. That is procedures what happens in European countries. And it can happen, you know, it is, we don't blame the company at all. It can happen also with any other products. You see that often with, whatever, what is it, what you have, something that has to be put in a small pot and that was an infection came in. Yeah, you have to recall it. Manufacturers of pharmaceutical products, they recall often their products. So it happened in production. We should not blame the manufacturer, but we have to see that procedures are getting better, that food safety is being respected, and all the procedures that has been laid down in the law. Ukraine have a very good system of regulation, and that should be very much respected.
Thank you so much. Було запитання з приводу, да, статистика минулого року.
Сьогодні тема дискусії кір.
Да, але останнє.
Today we have measles as the topic of discussion. And what about the statistics of botulism? 105 cases. So you should understand that in 2012 we had 13,000 cases of measles, and it happens, but it is many times less than measles.
Від ботулізму.
So about botulism. 12 deaths out of 105 who fell ill. So we want questions about measles. Tell us, please, about measles. Did we have lethal cases this year? In 2012, there were 3 lethal cases. And do you understand correctly that in order to buy for the state funding, not serum, but vaccine, for state budget funds, so we should make changes, and we believe we can do it, but in order to make it fast about the measles. So there are many pre-qualified and registered vaccines that were qualified by WHO, so we can buy it through local budgets, and this is the responsibility of the regions for vaccination of medical workers, adults. So this is their responsibility. Of course, we bear our responsibilities, but there are limits that restrict us, but we work on this. But in order to respond quickly on the situation, it should be done through local budgets. Once again, I would like to state that now we extinguish fire. We should do it, but this is not correct. We should not be firefighters. We should be architects. And if we vaccinate our kids, we won't have these 13,000 people who fell ill in 2012. So please vaccinate your kids and yourself. So thank you very much. Till the next time, goodbye. Be vaccinated.